Welcome. I'm Dr. Amjad Iqbal Khan. I welcome you all to the Afro-Asian Society for Ultrasound virtual lecture by our respected Professor Dr. Syed Amar Gilani. And it's a very interesting topic for ultrasound, which is now a routine in all the countries. But he will be talking especially about ultrasound in developing countries. So I welcome Dr. Professor Amir Gilani. Please take the mic and give your answer. Welcome.
Bismillahirrahmanirrahim. I'm thankful to the organizers of Afro-Asian Institute of Medical Sciences to arrange this seminar with collaboration of Al-Razi Institute, Lahore. I'm thankful to our moderator, my friend and my student, Dr. Amjad Iqbal Khan. He's one of the legends in ultrasound in Lahore. My topic today is very important topic as we are living in developing countries and there are variable standards, variable rules, regulations, education, and scanning standards in the developing countries. This lecture I prepared actually for Australian Society of Ultrasound and Medicine's 38th annual meeting, which was organized by Australian Society of Ultrasound in Medicine back in 2008. And it was based on my experience of traveling, teaching, and learning in different developing countries. I have upgraded few things after 12 years. A lot of things have changed. I will be mentioning that. So let's start. First is introduction. The diagnostic ultrasound is a rapidly developing imaging technology, which is widely used in both industrialized and developing countries. Ultrasound has found widespread applications in anatomical imaging, blood flow measurements, and evaluation of physiology in almost all aspects. For evaluation of physiology, I can give you the example of fetal echocardiography or adult echocardiography, in which you can see the real-time things which are changing. This presentation is based on my personal experience, which at that time was 64 countries I had visited in 10 years. And now in last 22 years, I have visited 97 countries. My latest country was Kyrgyzstan, Bishkek, where I was there to attend some of the conferences. It was about the medical education and business on Silk Road, and it was my 97th country. So now this presentation is not based on 64, it is based on 97 countries experience of last 22 years. Sorry, I didn't change this slide while changing other slides. I have just selected 20 important countries from developing world, including all regions of the world, regardless of their regional and religious origins. As I'm talking about different other countries, I have a disclaimer, and this rat explains my disclaimer very clearly that I hereby declare that I don't have any objective to degrade or insult any country or its experts in ultrasound. Rather, I wish to see them better so their nation and ultimately the humanity can get better standards of sonographic diagnosis leading to best healthcare in their countries. So it is based on my personal experience. There were some countries where I went once and I might have met the people who were not representing the whole of the standard of the country. So I will apologize for that. Whatever I saw, whatever I studied, whatever I faced, wherever I attended, any conference, seminar, workshop, this talk is based on that. So there will be nothing personal. The main objective of this experience-based presentation is to share my experiences with the participants of this meeting and the authorities in ultrasound. I hope the deficiencies pointed out shall be taken positively to upgrade the knowledge of ultrasound in these countries. Background. A WHO study, World Health Organization study group on training in diagnostic ultrasound, essentials, principles, and standards met in Philadelphia, which is in Pennsylvania, USA, from 22nd to 25th of March 1999, to consider methods of improving the performance of physicians and allied health professionals who use ultrasound for diagnosis of applications. That's why, as it was in Thomas Jefferson injury, I have put the picture of Professor Barry B. Goldberg, who was my teacher, and our moderator, Dr. Amjad Iqbal Khan, also spent few months there under his supervision to get the training. The need for adequate education and training in ultrasonography exists in both industrialized and developing countries. Moreover, the challenges of providing adequate training in ultrasonography is made more difficult by the diversity of its utilization, since no single medical specialty has a monopoly on its use. This is the main problem. Everybody in different fields or branches of medical sciences is trying to use ultrasound. If someone is orthopedic surgeon or rheumatologist, gynecologist, physician, a GP, a nurse, a health professional, they are using ultrasonography. So the standards are different, the applications and indications are different. There is no detailed international recommendation or guidance for training those who are using or wish to use this imaging technique. It was partly for these reasons that WHO prepared the Manual of Diagnostic Ultrasound, which provides guidance on the ultrasound diagnosis of a wide variety of common conditions at the primary and first referral levels for healthcare. Worldwide, it is like that much of the ultrasound currently performed is carried out by individuals with, in fact, little or no formal training. Further, the need for basic training is greater in developing than in developed countries. So basic training is very important. Variation in trainings and practice. After completion of specialized training, many radiologists in the United States continue for an additional year of advanced ultrasound training. I'm saying many radiologists, those who are already doing ultrasound, they are trained in ultrasound departments, they can do MR, CT, interventional radiology, they can do X-rays, mammography, fluoroscopy, but still, if they want to know the advanced ultrasound, they go for 6 months to 1 year advanced training. In other countries, ultrasound training requirements may be more, for example, Israel, or less demanding, for example, Turkey. In non-imaging specialties, training requirements also vary. Scandinavian countries require courses of 30 hours of ultrasound training for obstetrics. The countries like Denmark, Norway. And then we have 20 hours of cardiology, 24 hours for gastroenterology. So this is the minimum training they need. Ultrasound training for German physicians forms part of their internship and consists of theory and practical components, often directed towards the specialty they will practice. Whereas post-training evaluation is rare, but the organization of training program is well established. They have the objectives, the course contents, the outcomes, everything is there. So the curriculum is well established. Therefore, mostly there is no post-course evaluation for practical training. They give training to them. But yes, there are some courses, some training programs in which they nowadays they do the evaluation. In Japan, the Japanese Society for Ultrasound Medicine has formed a group of teacher physicians responsible for the training of doctors and other health professionals applying for accreditation in ultrasonography. This accreditation has not yet been accorded an official status. In Australia and New Zealand, the Australian Society for Ultrasound in Medicine in 1970 formally recognized the need for comprehensive education to ensure high quality practice in ultrasound. In addition, radiologists are trained only at centers accredited by the Royal College of Radiologists, which is also responsible for continuing medical education in the field. Joint programs with Royal College, such as the Royal College of Obstetricians and Gynecologists, are also being organized to provide advanced training in ultrasound to the physicians or obstetricians and gynecologists. If you look at Latin America, several different approaches of training exist. In some countries, ultrasound is taught during specialized medical training and consequently reaches only newly qualified physicians. In China, training schemes for both general and advanced ultrasound exist and can be attended at various stages of the medical career, for example, postgraduate or fellowships. The continuous education programs are currently being established and used in China. In the rest of the world, especially the developing world, however, the situation is quite different. Diagnostic ultrasound services are often not available at all or only at an inadequate level. And there are many individuals who are misusing it. The equipment is often old or inadequate because of a lack of funds. Consequently, it can be technically out of date or suffer from poor maintenance and unavailability of spare parts. There are very few formal training programs in ultrasound, with the exception of some centers where radiologists are trained at university hospitals. For instance, 3 years back, I was in Rwanda. In Rwanda, there are many hospitals where they have very advanced equipments which were bought on very high price as compared to Asia, especially as compared to Pakistan. But there were two things which I noticed, that most of the people are not trained to use these equipment, especially the color Doppler machines. And secondly, there was no backup. There was no biomedical engineer or technologist available. So once the machine is out of order, it goes to the storeroom and there is no maintenance. So this is another thing. In addition to the education, training, practice, accreditation, we also need biomedical engineers who take care of our machines. So in many of the African countries, I noticed that the biomedical engineers are not available, or the number of biomedical engineers is inadequate. Radiological societies may organize short refresher courses, but in much of the developing world, adequate ultrasound training or services are lacking. The accreditation of user and the control of quality are also rare. Let me introduce Professor Asim Kurjak, who was born in 1942 in Bosnia, Herzegovina. He graduated MD in 1966 and obtained his PhD in 1977 at the University of Zagreb School of Medicine, Croatia. Formerly, it was Yugoslavia. I have been to many countries which were formerly Yugoslavia, like Macedonia, Kosovo, Albania, etc. A very attractive area. There is natural beauty, and these countries are really places to visit. He served as assistant professor at the Department of Obstetrics and Gynecology at University of Zagreb from 1968 to 1980. He is head of Ultrasonic Institute, Zagreb University School of Medicine, which is a WHO collaborating center for diagnostic ultrasound. Recently, he retired, and he's heading the Eindhoven Inter-University Institute, which provides very advanced training, especially to the gynecologists and obstetricians. Barry Goldberg the Great, he did his BA in chemistry and obtained his MD degree from the University of Pennsylvania. He completed his internship in radiology residency at the Albert Einstein Medical Center in Philadelphia. Dr. Goldberg is currently Director of Division of Ultrasound and Radiologic Imaging and Professor of Radiology at Thomas Jefferson University School and Hospital, a post which he had held more than 20 years. Recently, I heard that he has retired and somebody else has replaced him. So this study is based on critical analysis of different aspects like standards of clinical ultrasound in different hospitals of a country, educational setups in universities and hospitals of that country, role of health ministries in upgradation of standards of ultrasound, CME programs, national society or association. We will be talking about the standards of ultrasonography along with the radiologist versus non-radiologist controversies, private sector, ultrasound education setups, guidelines and protocols in some of these countries. In this study, which is published already in a Scopus indexed journal, I have included 20 countries, which include Afghanistan, Bahrain, Bangladesh, Brunei Darussalam, Egypt, Georgia, Ghana, India, Iran, Kingdom of Saudi Arabia, Kosovo, Macedonia, both from the Eastern Europe, Malaysia, Nepal, Nigeria, Oman, Pakistan, Sudan, UAE, and Yemen. I just arranged them alphabetically, and you can see almost all important countries are there. There is a rich country like Brunei Darussalam, a Muslim country also. There is Georgia, which is from the Russian states. Then we have Ghana and Nigeria and Yemen. They are from Africa. Sudan is obviously from Africa. We have Saudi Arabia and UAE, which are from the Gulf countries, and Bahrain also. I have just 1 to 2 slides for each country, just discussing shortly. Although in the paper we had written all the details with references. Clinical ultrasound, in my observation, is generally very poor. No teaching setup on government and private sector. Few years back, Dr. Hashim Wahaj, a good friend of mine, he was shifted or migrated to Afghanistan. He has started a very nice setup in the hospital and is giving training. So this gap will be filled, and I wish him best of luck. He is doing a great job for Afghanistan, for the doctors and healthcare professionals for their training. One private hospital arranged a meeting few years back, and we attended that. The local standards were of average quality, but students had urged that they had a hunger to learn, and many of them are coming to Peshawar, to Dr. Nasir Hamid and some of other training institutions to get basic training and advanced training of ultrasonography. Circumstances are not yet favorable for teaching. So once the things are peaceful, I hope things will improve, especially the teaching programs will be better. No radiology ultrasound society exists. There are 1 or 2 societies, but these are not the official societies as per my information. If it exists, somebody can provide me information, so I will change this line. Then is Bahrain. I will be going alphabetically. Salmaniya Hospital, Manama, Bahrain. I was there in 2000, and some of the students, they did training with me from 2000 to 2008. They were coming to my clinic. This was a group of gynecologists, and we arranged advanced TVS and ultrasound guided training, TVS guided interventions for them. It was a 3 days training. Then we had 2 days for color Doppler. The standard of physicians was good. There were many good teachers who were involved in this training. We had some Indian professors who were also attending, and they had extraordinary knowledge about the subject, especially the gynecology and obstetrics. We enjoyed sharing knowledge and giving them training. The overall training was good. The standards at Manama Hospital at that time was good, and I have some friends that still working in this hospital, and it has improved a lot. There are many foreigners who are working, and there is diversity of knowledge and experience, but we don't have any sonographers who are having their programs, training programs, but obviously there are some sonographers who are working. Most of the ultrasound is done by radiologists and gynecologists themselves. Another interesting thing in Bahrain was there are a lot of Pakistanis working in police. So I was invited by them. A policeman was retired on that day, so they had arranged a farewell for him. So the standards of clinical ultrasound are variable. As I mentioned, there are people from different countries having different standards, different experiences, different level of knowledge. So the standards are variable, generally are not very satisfactory for a rich country. If we compare it with other Arab countries, it is far better. But when we consider that it is a rich country, the standard can be far better. There are chances to improve. There is need of having CME programs. Government spends money on training and CME programs, but most of the physicians are the least bother about learning. This is the problem which we have seen in most of the rich Gulf countries, that the governments and their societies, their associations are spending a lot, but as it is free, so most of the people who are attendees, they don't bother about it. Radiologists have influence, therefore sonographers and sonologists don't have much chances for upgradation of their skills. Although there are people who are sonologists, gynecologists, or sonographers in their hospitals, but there are least chances for them for upgradation. So as a rich Arab country, they can improve it. Then comes Bangladesh. Bangladesh, we have got variable standards, like in Pakistan, generally are not very satisfactory. In government hospitals, there is no proper training even for radiologists. Bangladesh Ultrasound Society arranges few CME programs and training diplomas. Especially Dr. Kanu Bala is working a lot along with the World Federation of Ultrasound in Medicine and Biology, and also with JURI, Jefferson Ultrasound Research Institution. There are 3-4 private training centers. 2 of them are by my own students. They got training from me in Pakistan, but just offer 4 to 6 week courses for physicians. Radiologist versus sonologist controversies exist, like in Pakistan. No setup for training of sonographers. So that is a problem. So if we don't train the technologists, nobody will be there to assist us. Then we come to a very rich country, Brunei Darussalam. I went there to attend a conference. The standards of clinical ultrasound generally are not very satisfactory for a rich country. Again, there are people who are working there and they are from different other countries. The local physicians are not that much trained. So in my opinion, if you have experts who are working for you in your rich country, but they are not your national, we don't include them in rating of standard for your nation, because they are just serving you. You have borrowed them or you have just engaged them to do the clinical work. So the main thing is that the local people are get trained from these experts who are foreigners. So better is to bring the people to teach your own nation, your own youngsters. So there were people who were working, they were good, but I didn't find it standard. Even the standards were not compatible with the standards of Bahrain and other rich Arab countries. Not many training and CME programs arranged. You will hear a conference, ultrasound or radiology conference, once in 2-3 years. Most of the foreigners who are radiologists are employed. No system for proper training for physicians or sonographers. No society or private institution for training of ultrasound. So there is no association, no platform. Egypt. The standards of clinical ultrasound are variable. There are people who are extraordinary. There are many extraordinary teachers who are Egyptians. They are having extraordinary experience and they are teaching. You can find many Egyptian brothers and sisters who are teaching on YouTube. They are working abroad, but there are local people who are performing ultrasound are not of that standard. Generally are not very satisfactory. There are training programs for radiologists and short training for physicians. This is a positive thing, but have many deficiencies. I attended 3 conferences, the national conferences, One of that was the gastroenterology society and the radiologist society. They were they arranged that, and even in the radiology society, most of the people were talking about the hydrated cyst and its ultrasonography. So I saw that people are just moving around the role of sonography in hydrated cyst. Nobody was coming out of it. So it becomes boring when you have Radiology Society's international conference. I think it was 2005 or 6 in Cairo. So we have to discuss many modalities of ultrasound once it is a National Radiology Society conference. But that was my experience. They might have different conferences and they might have different things available. I just went twice and this was my experience. Some of the radiographers trained in some hospitals do private practice of ultrasound with or without any accreditation. And there was again the problem of proper accreditation or any council or society for them. There is Georgia, which was part of Russia. I went to the capital Tbilisi. The ultrasound was good, but the people I met in their hospitals, they were good in abdominal and hepatic ultrasonography. They were good in Doppler. Unfortunately, I was not able to see their standards in gynae and obstetrical ultrasound because the conference was on abdominal and small parts. So their standards were good, but were not compatible with the developed countries like Australia, USA, UK. This was my friend who was the host, and this was the city Tbilisi. The picture is from Sudan. For Ghana, I didn't find any picture in my hard disk. So Ghana is good. The doctors are good. Most of them are trained in India from Delhi, and their standards are far better than other African countries, although they are not that much expert as our students in Sudan, but they were good as compared to other African nations. They don't have any society. There are many sonographers who are doing ultrasonography. There are many physicians who are performing ultrasound. The people have hunger to learn in Ghana. Then is Macedonia. Macedonia, where we had a conference in Ohrid. Ohrid is the city where Alexander the Great was born. And this was a conference on musculoskeletal ultrasound, and there were many experts from different countries, like Dr. Graf. We have got the Graf alpha beta angles for pediatric hip scanning. So we attended that. The local Macedonian had good standards. Most of them were orthopedic surgeons, but they had exposure to musculoskeletal ultrasound. I didn't meet any obstetrical or abdominal ultrasound people, just asked them about the society. They had Ultrasound Society of Macedonia, they had the Orthopedic Society, and they had programs. Professor Dr. Poposka is one of the leading orthopedic surgeons from Macedonia, and they arrange a lot of CMEs. So people are good, they have updated knowledge. They were one of the best countries regarding ultrasound programs and CMEs in the Eastern Europe. This was all Macedonia. There is Republic of Kosovo, is a small country which was previously a part of Yugoslavia. He was the first president of Kosovo after its independence. His name was Fatmir Sajdev, and we had different courses. I conducted the gynae ops ultrasound training program there twice. And then we had basic training and vascular training. She was the mayor, I don't remember the name, but their standard is good. Dr. Salmaniya is one of the leading gynecologists. He had the most expensive Aloka machine at that time when I visited in 2011. And then my last visit was in 2011. And he was extraordinary. The only thing was that they were using Albanian language. And he was one of the best students of Professor Asim Kurjak. The probe head was downward in Eastern Europe as compared to the probe head which we keep upward according to AIUM protocols. American Institute of Ultrasound Medicine says that we keep the probe head upward while scanning, whereas the protocols which were used before 1986 worldwide and even nowadays in Eastern Europe is that we put the probe head downward. So everything will be reversed on the image. And they also came to Pakistan. We had a very nice conference. This was the Kosovan cultural dance we had, and we arranged a Pak Kosovo conference. Then comes India, our neighboring country. I was there 4 times to University of Lucknow, and then I went to attend a conference in Delhi, which was arranged by Indian Federation of Ultrasound in Medicine, and I conducted a shoulder and knee joint workshop there during the conference. And when we talk about the Indian radiologist or sonologist, the people are extraordinary in the region, very you can say that they have the updated knowledge, they have interest, the people are good, and all of them were very friendly, and they really know ultrasound. There were a lot of CME programs where people wanted to share the knowledge. Most of the people were even sharing their PowerPoint lectures with each other. And the hospitality was good. There are radiologists, there are sonologists, and obviously the controversy exists there. But like Dr. Suresh, and there are many people who are sonologists. They are not radiologists, but they have got respect, and they are doing good job for ultrasound education, even for research. These were the friends. Dr. Yashodhara and her husband, they were here in Lahore with us. This is the Imam Barga, the largest in Lucknow. Then we come to Pakistan. This is Minare-Pakistan and Bashai Mosque, the historical places. We had Indo-Pakistan conference in 2004. We had friends from Yemen, from India, and we had many other people. We arranged short courses, and then was the conference. Many of the legends from Pakistan were there, like Dr. There are few people who are, you can see the Indian speaker who is nowadays in America. And then we have Dr. from Multan, and a lot of people were there. Then in 2006, we also arranged Pak Kosovo conference. The standard of teaching was good. The health minister of Kosovo was also invited it was arranged in PC Lahore. Dr. Suleiman Salami was also there, and this was a nice conference. We learned a lot from them. There were excellent lectures from the Kosovan presenters and from the Indian speakers. In Pakistan, we arranged different courses, different workshops. We used to have annual conferences, and still before COVID, we were having a lot of conferences and workshops. We arranged many short courses and on basics and advances. Then with Sudanese universities, we were having some master's programs. And then we started having proper BSc, MSc, then MPhil and PhD in ultrasonography at University of Lahore, which is the largest university in Pakistan, including amongst the private and public universities, having 44,000 students. And we are offering PhD, MPhil, and other degrees, undergraduate degrees in specifically for medical imaging. And then we have these degrees for medical diagnostic ultrasound, which are accredited by the Higher Education Commission of Pakistan. We don't find many countries which are offering such degrees in developing countries. We are going to start such programs in Nigeria, inshallah, soon. And in Sudan, we started in Al-Zaim Al-Azri University, and in Sudan University of Science and Technology, we have such programs. So in Pakistan, we have radiologists who are working. Then we have some of the physicians or GPs who are scanning. They have variable knowledge and training background. Most of them are very good. There are about 50 plus people in Pakistan who are performing ultrasound for more than 5 years. Most of them are scanning from last 15 to 25 years. They are very good in ultrasound. They have very nice equipments. Lot of patients are there. Their diagnosis is very good. And after MBBS, they had experience. So we offered them 2 years program, which was full-time along with research, with thesis, and they passed their MPhil or MSDU, MS in diagnostic ultrasound, which is 18 years education. So they are qualified, and there are more than 50. Similarly, if we look at Nepal, in Nepal, there are many people who are working in ultrasound, but I didn't find many people who were very good, like Dr. Mukhtar. He is one of the Nepalis working as professor of radiology. He did his MBBS, and then he did his PhD from Japan, which was in radiology. And Dr. I think his name was Joshi, Professor Joshi, who was one of the senior radiologists. And this is, you can see back in 2008, which was in Kathmandu. It was a Nepal Pediatric Society which arranged 2 parallel programs. One was of pediatric, the other one was of radiology. These are the courses which I conducted. This was the basic training program which I conducted in 2000 in Thapathali Maternity Hospital in Nepal. And this was then later on in 2001, we arranged a workshop for obstetrical ultrasound. Iran. In 97 countries which I have visited to learn or train ultrasound or train the people in ultrasound, I found Iran to be the best. If you ask me to rate it, I will say that after USA, Australia, New Zealand, and UK, if I rate Iran as number 1 in the developing countries, it won't be wrong. These are the legends of their radiology, And with me was Professor Guido Ribotti and Dr. Campani from Italy, Dr. Ribotti from Switzerland, and we were astonished to see the standards. The standards were very high. The equipments were available in all the hospitals. Even there were, when we went to Namazi Hospital in Shiraz, we found that there were MRI which were packed and there were MRI which were installed. So the packed one was waiting. If it is needed, they can assemble it and they can use it. So there was no problem with the equipment. The standards of the research was very good. The scanning was very good. Their questioning was very nice. And from that day, I'm fond of them, that they were very good and they were teaching each other. The atmosphere was very friendly. So when you ask me to rate any country in standards, accreditation, quality of education, I will say that Iran is number one and India is number two. As I mentioned in the beginning that I will talk about my personal experience. I said in my disclaimer that it is a lecture about standards and quality of education in developing countries, so that if you want to move anywhere, if you want to learn, either go to the developed countries or go to Iran, you can learn a lot. Malaysia. We arranged multiple courses in Malaysia. I was invited in different hospitals. Even Dr. Mukhtar, who is from Nepal, was working in Malaysia. They invited me to talk about carotid scanning and knee scanning. So in Malaysia, the standards were good, but you cannot say that these are matchable with Iran or India. Yes, we can compare it with the standards in Pakistan, but in arranging conferences, CME programs, basic trainings, I think the Pakistanis are better. It's my opinion. You can get individuals who are good, but I'm talking as a nation, and most of the people, they can scan in their clinics, but we don't have any extraordinary ultrasonographers or any extraordinary training programs. Dr. Ibrahim, who is basically from Myanmar, but he is the Malaysian national, he tried to arrange some of the workshops, and I was invited for 4 years. I was traveling there for a week, 4 times a year, to arrange different fast track basic programs on different topics for the physicians. A lot of people were coming and people were learning. So even some of them, they came to Pakistan to get training. Sudan, my second home, lot of students were there and they were having MSc in ultrasound, and then the PhD was started. And from 2002 till now, we are working with them. A lot of them are brotherly. They respect a lot. Like Dr. Safi, he did PhD. He was the dean of Sudan University of Science and Technology. Here is the vice chancellor of Sudan University of Science and Technology, who was later um, the Ministry of Higher Education of Sudan. And I took many other professors there. We arranged a lot of things, and I'm happy that my students who did PhD and MSc there, they're continuing it. They have a Sudanese Society of Ultrasonography on Facebook and on website. They have their pages. They arrange a lot of courses. The people are learning and they are working in the Middle East. There are a lot of them are working in UAE, in other Arab countries, in the Gulf, in Saudi Arabia, and they are very good. They have a good sense of hospitality. And as a nation, I love them. I always think that it is my second home because I have more than, you can say, about 500 to 600 students uh, to whom I was delivering lectures for MSc honors, which is equivalent to MPhil. And then I supervised about 32 PhDs in ultrasonography from Sudan. I worked with collaboration of Sudan University of Science and Technology, Khartoum, and with Al Azhari University. So the standards have improved a lot in the last 10 years. There are many even speakers. If we look at the speakers in Africa for ultrasonography, we will find many Sudanese. This was the Sudanese Radiology Society meeting in one of the meetings of their College of Physician Surgeon, which was established by Pakistani College of Physician Surgeons. Then there are different events we had in Sudan University of Science and Technology. Next country is Nigeria. In Nigeria, the standards are good. The accreditation is good. Like in Sudan, the sonographers can work, but again, there is problem with the registration of sonographers because of the Sudanese Medical Dental Council. Similarly, in Nigeria, people are learning, but I think the Sudanese standards are better than the Nigerian standards of ultrasonography. And in training, we need more training programs. We need more postgraduate programs in Nigeria. In Kingdom of Saudi Arabia, again, the local people, they need to get training. We arranged some of the courses at Mahad Sharq Ishbiliya Sahih, which is the institute, which was the Ishbiliya Institute for Health in Riyadh. And we went there and we had many workshops for them. With me was Dr. Nasir Hamid. These were in Saudi Arabia, in Dammam and different areas. Then in Oman, the standards were extraordinary. And this is the Arab country where I saw that even the Omanian nationals, they are good. I found few people who were vascular surgeons, and they were trained in Canada, and they themselves were good in vascular ultrasonography. Whereas if you look at Saudi Arabia, UAE, you will find that many foreigners are working there. The standards are higher because of the foreigners who are working in their country. But Oman was the only country where their own radiologists, the Omanian nationals, they were extraordinary. They were of world class, and they were trained in, most of them were getting training from Canada. I think they had a trend to get training from Canada, or maybe the government was offering them scholarships to get training. So many having the board qualifications of Canada in radiology and vascular surgery. I conducted a 1-week workshop on vascular ultrasonography, and I was impressed by the locals. There were many Indians and Pakistanis and other radiologists who were attending, but the standard of the locals was marvelous. So I appreciate their work, because if a country has got money, it is better to train their own nationals so that they can serve the nation and humanity in future. This was in Muscat, Oman. It was Sultan Qaboos University in Muscat. Then is UAE. In UAE, we arranged many workshops with many international speakers. There were many workshops arranged by Pakistan Ultrasound Society. The standards of these international conferences are good. Then they established having Dubai Health Expo, and in which they have different workshops. The standards are good. And there are a few local people who are getting training. The standards have improved. There is Sharjah University, which is training the sonographers. And this lady was from Sharjah University. This is another lady who was from Sharjah University. So they are training them, and a lot of friends are working there. So in UAE, they register the sonographers and the sonologists and radiologists. So this is the criteria which is used by UAE government must be followed by the Pakistani government to register sonographers, sonologists, and radiologists. This was in Sharjah University, and this was in Dubai, in which many people from different countries were there. It was an international conference which I arranged, and there were speakers from 9 countries. And here we had lectures for the students of Sharjah University. They have a Department of Radiological Sciences, which is offering BS in Radiological Sciences. And I heard they are starting MS or MSc, but I'm not sure they have started or not. This guy is friend of mine who is Sudanese, and he was my student. He was working in Sharjah at that time. Now he's working in Abu Dhabi. Then comes Yemen. As why comes, it means it is the last country I have to talk about. There were many seminars which we arranged and we attended in Sana, in Thora Hospital. The interesting thing was Gath. Gath is like Naswar, which is being used by most of the people. And when you talk about 1 to 4 o'clock, almost whole of the community, especially when we were there, about 95% of the doctors, they escaped. We didn't know that the workshops must end at 1 o'clock. So a lot of people were there, about, I assume it was about 100 people from 8 to 1. And at 1 o'clock, people started leaving. And I was astonished at why at 1 o'clock, instead of completing at 4 o'clock, we had to complete it at 1 o'clock, because everybody was going to chew, which are leaves, to chew gath, and they said they will be coming back after 4 o'clock. So we had to change the time. The standards were not very good. People are scanning. There are good radiologists. There is no proper training program. There is a society, but not very effective. I found that Gath is spoiling everyone, causing the tongue and gum cancer. But this was the problem. It is also used by some of the Somali and Egyptians, but in Yemen, this was my experience. So the standards were not good, because your daytime, about 3 to 4 hours of your daytime are spoiled in chewing gath. This was the military hospital in Sana, where we arranged a workshop. Teacher training programs, last 2-3 slides. The development and implementation of intensive training programs, especially for ultrasound instructors, are desirable and has been established practice for many years in some countries like Germany. Models of such programs have been developed at the Jefferson Ultrasound Research and Education Institute in the United States. Licensing and accreditation of ultrasound practitioners and teachers are the responsibility of local, national, and regional governmental authorities, professional societies, and other recognized organizations. Regardless of the level of expertise required, all instructors and practitioners of ultrasonography should pursue continuing education through refresher courses and conferences, as well as those offering updates on new technology and practice. Regional centers should be established with the collaboration of all countries in region, and preferably with the assistance of international professional organizations. Training centers should have adequate equipment and should be responsible for the implementation of educational programs. Access to patients. Training centers should have access to patients presenting a range of conditions appropriate for the areas taught. So developing countries need your help. Serve the humanity by training them. We need people from developed countries. They come to us, they train our people, they arrange workshops, they arrange webinars nowadays. Webinar is a good modality to teach. We are waiting for them to teach our people, to train our people, mm, to upgrade their standards according to the international standards. Thank you very much.
Well,
Any
well,
questions?
well. Well, sir, it was a wonderful talk. Thank you for sharing your experience through a very thought-provoking talk. And it was not only your comprehensive and wonderful overview on ultrasound in developing countries, but let me say that you took with you in free to a word to word all the participants. So thank you very much. There are a few
Welcome, sir.
questions. There are questions from Hina Gul. How ultrasound can be improved further in Pakistan and as it needs, though, as almost every woman go through it during pregnancy conditions.
The first thing is that for standardization, there must be licensing. In Pakistan, if we want to improve the standards, we must have a licensing through a council or by the PMDC, which is now PMC, or by healthcare or authorities. If we don't have licensing, the standards will not be good. We cannot improve. The second modality to improve is to have clinical practice. There is deficiency of clinical practice. The people who are good, they are not teaching the others. The third thing is education. So there are refresher courses for people who are already in the field, and there are undergraduate and postgraduate courses. One must go for graduate or postgraduate courses instead of having just short courses. The short courses are to give you a starter, to give you a thought that you have to learn this modality. It is good for you as a health professional. So don't rely on short courses only. Just uh, take them as starter and then go for postgraduate training programs. This will increase the standards.
Thank you, sir. Uh, Another question from the same participant. I couldn't understand if you can please answer. Why the results of ultrasound in developing countries like Pakistan are so silent?
the, the results are not silent. The results are very clear and bold. I think in developed countries, uh, their results are not very clear. They give you many options, they give you many differentials. But in Pakistan, they are very, you can say, bold and blunt. They give you uh, spot diagnosis, which is not good. There must be a differential diagnosis. The ultrasound is not a modality that it gives proper diagnosis of everything. So we must use other modalities also. For instance, if there is a mass in abdomen, I say that there is a mass and there is a flow, it is central flow, it can be a malignant lesion, but I don't say it is a malignant mass. I will say that it can be a malignant mass, it can be a benign. For confirmation, I advise CT and I advise biopsy, ultrasound guided biopsy. So this is how the developed country, the people in developed country, they report. Whereas in Pakistan or in developing countries, while scanning, we even give the diagnosis, and even some of us, they give the treatment also. So that is not the way.
True, sir. That's very good. Not a single modality can give answer for the final diagnosis. It can just based on the observations. And
Yes.
then, sir, there is Zoha Sajjad. A very interesting question. How ultrasound is misused and why? Number one. Number two, is it being misused in Pakistan as well?
Ultrasound misused means that people are giving spot diagnosis. Secondly, if there is no indication, people are being referred for any share or any other interest. So ultrasound must be recommended or advised when there is a need. For instance, in pregnancy, we usually advise a scan at 5 to 6 weeks for confirmation of pregnancy. Second is at the first trimester, which is from 12 to 14 weeks, to have a normally scan. Then we can have second trimester and third trimester scans. So 4 to 5 ultrasounds are enough. So misused means when they advise twice a week or twice a month, and it means that whenever you go to the gynecologist, she will be scanning. If you have to go for any pain or any spotting, she will be scanning. So at the end, you will have 40 scans in 40 weeks of pregnancy. That is how it is misused. Second thing is that the diagnosis is not proper, and there are few people, they just rely on one report. There must be reconfirmation by before going for any surgery, especially for any intervention. This is how we are misusing. So professional abuse is there in developing countries, in most of the developing countries.
You're very right, sir. You're very right. Diagnosing an hydrocephalus on 33 weeks or a spina bifida on 33, 34 weeks. That is the dilemma. Then there are two questions from somebody anonymous. I would go for our second question first. If sonographers are not allowed to perform the ultrasound in Pakistan, then why even universities are offering these courses? And related to this is the second question, sir. As every country has a registration system for sonographers, why don't we have it? The same person.
Yeah. It's interesting question, and we discussed it in my last lecture, which was about 2 weeks back. As I mentioned, in UAE, in Saudi Arabia, which are Muslim countries, we label them as developing countries also, or emerging countries. They register sonographers. Now the question is why Pakistani universities are preparing them. In Pakistan, we have about around 1,500 to 2,000 radiologists for a population of 220 million. Do you think they can meet with the need of ultrasonography of 220 million? They need assistance of sonographers. They have to accept them as their colleagues. They have to arrange their licensing. They have to establish a council for them, and they have to recognize them as recognized by UAE government, by Dubai. If you have ARDMS registration, American Registry of Diagnostic Sonographers, they allow you to apply for license as a sonographer. There are many students of mine who are sonographers, and they are working in Abu Dhabi and Dubai, and even in Saudi Arabia. There are many Sudanese who were my students. They are working there, and they can perform ultrasound under the guidance of a radiologist. They don't write report. There are two different things. One is writing report. A sonologist, a physician who is a sonologist, having training, proper training of ultrasound, having a license, can write report in Saudi Arabia, can write report in UAE. For instance, one of our student who did PhD from us from University of Lahore, Dr. Tokir Abbasi, is working in military hospital Riyadh, and he is scanning. He's not registered as radiologist. He is scanning and he is writing report. There are few other people who are physicians working in UAE. They can perform and they can write report, but it depends on the hospital and the country where you are working. Another thing for this question, that why Pakistani universities are preparing people who are sonographers, we are not preparing the sonographers only for Pakistan. We are preparing them for Canada to do ARDMS, where every year they need 100 sonographers from Pakistan. Only 2 to 3 they apply. People even don't know that there are immigrations for sonographers in Canada. So we prepare them for USA, we prepare them for UAE, for Gulf, for Arab countries. So if they are not allowed to work in, they are not allowed to write report, they are not allowed to do the patients privately, then it doesn't mean that we stop training people, because then uh, in foreign countries, in developed countries, we will not have any sonographer belonging to Pakistan. So nowadays, we are preparing people for advanced countries, for Gulf, and even for the public sector, for our hospitals. In public sector, these sonographers, they are working, they can work. There are many MD and BS MIT people who are getting jobs in different public sector in 16th and 17th grade. They are working already, they are working. The only problem is either they can write a report or not. So there are many advanced countries in which the sonologist cannot write a report. That is another problem. So we cannot mix these two things. Sonographers who are trained by universities, who are educated by the universities in Pakistan, they can work in Pakistan, but they cannot have a private clinic to write the report. For that, we need a licensing. For that, we need a registration.
So meanwhile, there is a comment from Mavish Talib in UAE that they can there perform and write reports for obstetric ultrasounds.
Yes, in some centers they can do. Even in Abu Dhabi, there are some centers.
So if you have time, there's the last question about a concerned person after MIT degree that for further experience, they need to do internships. While in public sector, people, some of the people don't allow, and the other ask for charges.
This is not a personal problem. This is not from the society. Actually, there is an ordinance, especially which I know is the clause number 42B by the Punjab Health Ministry. Somebody told me,
Yes.
according to which a private institution cannot have collaboration MOU with a public hospital because the number of public hospitals is small. So they prefer to take the students of public universities, public institutions, public colleges to train them in the public hospitals. We don't have many large hospitals in private sector which can offer practical training. So it is a matter of time, and I think in next 5 to 10 years there will be lot of hospitals which will be providing us practical training. Yes, we are facing problems. We are reducing the number of students which we are taking so that we can provide them quality training. We are going to open some new diagnostic centers and small hospitals or community centers which will be operated for from the by the university, and it will be offering free services to the patients so that our students can get training. Yes, at moment at present we have deficiency of clinical training for the students who are being educated in private sector.
So I think I must ask the last question because of your time. There is rather comment. There are so many questions. You'll be sitting an hour and answering those. I hope it's our friend and respected Professor Iqbal Dogar Saab, who is writing, ultrasound will be future stethoscope. Sure, very true. How we can reduce
Yes, sir, I
radiologist
agree.
versus non-radiologist differences, and how can we standardize ultrasound practices? And you have talked in this lecture and the last two.
Yes, sir. The Iqbal Dogar Saab is professor of radiology, is a friend of mine.
Wonderful man.
He has asked two questions. The first thing is that there are controversies, and it is the Radiology Society which has to formulate the limitations and standards for radiographers versus radiologists, radiologists versus sonologists, radiologists versus sonographers, or PMC, or a council which deals with the technicians. We are not in a position to dictate radiologists or anybody. They are our brothers and sisters. Uh, it is their field, but they need help from radiographers and sonologists and other people. Uh, about 2,000 radiologists in Pakistan cannot serve whole of the 220 million population, which is according to 2008. And I think now the population must have reached about 350 million instead of 220 million, because nobody is going for counting. So yes, it is future stethoscope. Every physician, every healthcare professional can use a stethoscope. So why not ultrasound? Why the radiologists are not allowing the people to use this stethoscope? Anybody having white coat must have a stethoscope in his or her pocket. Similarly, must have a portable ultrasound. Nowadays, you might have seen a small mobile like of this size, small
Yes.
ultrasound which can be attached. It is cable-less and you can scan. So why not a nurse having a stat and um, portable, small, handy mm, ultrasound probe or machine in the pocket and scan the patients. So this will improve the standards, but we need guidelines, we need council, we need standardization, we need protocols, we need registration, which is the duty of Radiology Society of Pakistan in collaboration with PMC and with the Healthcare Commission. I'm just talking about these controversies will end up the day once you arrange all these things. So I will request Iqbal Dogar Sahab to convince the people, the Khwaja Khurshid Sahab and others, Professor Nawaz Anjum Sahab, to have some protocols and some uh, standards so that we can differentiate between these things and we can improve the standards. Iqbal Dogar Sahab has asked another question. Can you further elaborate about Iran standards? The Iranian standards were so good, sir, that even their residents, they were aware of the different differential diagnoses on ultrasound. They were performing some interventions. These were the radiology residents, and their gynecologists were also good. So I believe they were extraordinary. So if you need details, we can have a dinner invited by you, and we can discuss about the standards of radiology in Iran.
Sir, I not only seconding you, but I would be happy to host such dinner where our senior respected friend Professor Dogar Saab come in, and we can take Professor Nawaz Anjum Saab with us and sit together how they plan for these things.
There is
And that
another
will
question, sir. I am a Nigerian radiographer, sonographer, would like to have a PhD in ultrasound at University of Lahore. If he or she has got MPhil, 18 years qualification, accredited by Higher Education Commission of Pakistan and Foreign Affairs and Higher Education of Nigeria, he or she can apply. It is 3 to 5 years full-time PhD at University of Lahore. The admissions will open from next week and will close within 1 month. So they can apply. They can send us their details and we will consider. But if is not holding 18 years education, then can apply for MSDU, which is the MS in diagnostic ultrasound, for which we need 16 years qualification, accredited by Higher Education of Nigeria, attested by Foreign Affairs of Pakistan and Foreign Affairs of Nigeria, then followed by attestation from HEC, the equivalent certificate, so that there will be no problem for registration of PhD degree. Anything else, sir?
Sir, that's all, I suppose. There are small questions, but will be too long. If you want, I
Okay,
can
sir.
carry on.
Thank you. Thank you very
Sir,
much, sir.
thank you for your talk,
Maghrib
sir.
time,
Thank
sir. Thank you. Allah Hafiz. Allah.
Allah Hafiz. Thank you, participants. I hope most of the questions have been answered. And till next time, goodbye. Take care of yourself. Thank you. Allah Hafiz.